Hello, my name is Vee Maliyasena. I'm a respiratory physician and I see patients at Family Doctors Plus. So silicosis is a really controversial topic that you've probably heard about a lot in the media, particularly in Queensland. So silica is a naturally occurring mineral that occurs in the environment. It's very commonly found in things like sandstone, gravel, rocks. It's also a main component of things like concrete that you see in the construction world. So in the naturally occurring world, we can be exposed to silica and it doesn't cause any problems. But when the silica is ground up and what we call aerosolized or released into the air, we have the ability to breathe that silica into our lungs. And these particles are really tiny, and when they get into your lungs, they can actually cause lung disease. So silicosis really just means diseases of the lung caused by exposure to inhaled or respirable silica, as it's known. There's different types of silicosis. There is acute silicosis, which is really quite rare, but we're starting to see a lot more of it in Queensland due to the recent exposures of patients who work with kitchen bench tops, which I'll touch on very shortly. But really it causes very severe lung disease and people end up dying, but we don't tend to see it very much. The most common cause of silica is what we call chronic silicosis, and there's two different types. There's simple, which is lots of little spots in your lungs, and then there's complex, where there's lots of little spots. They get together, they cause really big spots, and those big spots can cause scarring or fibrosis in your lungs. And that can generally cause people to have lots of symptoms like shortness of breath, fluid around the lungs, so on and so forth. The people that we worry about who are at risk of exposure to silica traditionally used to be people who were involved in stonemasonry, people who use jackhammers to, for construction and things like that. Any occupation where you're disturbing the natural surface of a rock or concrete. Nowadays, particularly in Queensland in the last 2 or 3 years, we've had a lot of cases of young, particularly men, who work in the artificial stone industry. So artificial stone is basically produced by taking silica, compacting it down, and then it's cut into certain shapes so that it fits in our kitchens. We can put our sinks into it, also used for bathrooms and laundry bench tops. In terms of investigation, so if you do think that you have exposure to silica, or your GP thinks that you may have been exposed, or you have x-ray evidence to suggest that, you really need to be seeing a respiratory physician. And what we will do is we will take you through, we'll do some breathing tests, we'll do some more proper CTs, and we actually now in Queensland have a thing called the Dust Diseases Register. So anyone that we see as lung specialists who has evidence of silicosis in their lungs, we automatically refer to the Queensland Dust Diseases Board. And it's just a national register that we've started in the last 6 months just to keep a track of how many cases we have. And in terms of treatments, unfortunately silicosis is not curable. Unfortunately, the only treatment for it is oxygen and a lung transplant. So the earlier you can catch it, the better. So if you are concerned that you may have been exposed to respirable silica in your workplace, particularly irrespective of whether you're young, whether you have no symptoms, if you work with artificial stone, I really urge you to go and see your GP as soon as possible. Don't wait for someone else to find out or for you to get symptoms. It's really important that you advocate for your own health and that you seek the care that you need. In terms of things that we can do to prevent silicosis, one of the things that we normally recommend from a workplace perspective is that the stone is wetted down before it's ground or cut into shape. That reduces the amount of respirable silica that is exposed, but it doesn't eliminate the risk completely. If you are working in the artificial stone industry, it is really important that you wear proper personal protective equipment, not just a simple mask, but a proper respirator mask. If you're not sure what that is, your employer should be able to assist you, or alternatively we can do face fit testing for you here, just so that you know that you can go into your workplace wearing adequate protection.